Fibroids, or myomas as we call them, are benign, non-cancerous growths that occur from the muscle layer of the uterus. When you harbor a fibroid and you've been symptomatic, like having heavy periods, prolonged periods, or frequent periods, or you're experiencing severe pain during your periods, or there is on and off an abdominal pain that is caused by it, or fibroid is suspected to be the cause of infertility, and very rarely a huge fibroid might cause compression on the adjacent structures, you might be advised to go ahead and remove the fibroids as a treatment. The first option would be to remove only the fibroids and to retain the uterus, especially if you are young and you want to retain the uterus for the purpose of menstrual function or for future fertility. Traditionally, fibroid removal retaining the uterus, what we call as myomectomy, was done through a big incision on the abdominal wall, which is about 10 to 13 centimeters in size. But now, laparoscopic myomectomy, or removal of the fibroid through laparoscopically, is the current practice. Clearly, as we know, laparoscopy is associated with less blood loss, less chance of post-operative wound infection, shorter hospital stay, and much faster recovery. So the fibroid that is removed from the uterus, we use an instrument called morcellator, which cuts the fibroids into small strips of tissues, and we retrieve them or remove them through the small incisions that we make on the abdominal wall. The incisions are just 3 to 4 in numbers, ranging between 5 to 10 millimeters in size. But one should always remember that when you are opting for myomectomy, the chance, very rarely, about 1% chance that you might end up in removing of the uterus, called hysterectomy, can happen if the bleeding from the base of the myoma, we call the myoma bed, becomes uncontrollable.